My name is Corley Houston, and welcome to Everything You Need to Know About CPR. I think we should all know how to do CPR, and when those emergency situations happen, we should know what to do and act quickly. First off, what is CPR? CPR is cardiopulmonary resurrection. Basically, when you go into cardiac arrest, your heart stops and you stop breathing. CPR is the only thing that can save your life when dealing with not being able to be in the hospital. Within 4 to 6 minutes, your brain is already becoming damaged. So when you learn how to do CPR and somebody's in cardiac arrest, you can help save their lives. These people can be your family members, your friends, or even a stranger. And I just want to talk about the steps of how to handle yourself and how to get things done quickly and fast. The first step is check for safety. This is a big one because not always when we don't never know when somebody's going to cardiac arrest. It can happen anywhere. So when they go into cardiac arrest, they might be somewhere dangerous or somewhere not quite safe to do CPR. Everything when you're doing CPR needs to be done fast. So you need to look around quickly and to see if you're somewhere safe. Like, are you in traffic or are you somewhere that's dangerous? You need to find a safe place for you and the person, because if you get hurt while you're trying to help them, you're both going to be in need of help. So that's the first step, really getting there and making sure that you and that person's okay. The second step is to check for a pulse. You really want to check to see if that person is responding. Like, you want to shout, "Hey, are you okay?" Or, "Hey, can you hear me?" If they're unconscious, that's your sign that you need to call for help. And because sometimes it might not always be cardiac arrest, but with them being unconscious, it's best to at least know that you can try CPR as a measure to help. You check for breathing by placing your hand in front of their mouths, or even reading their pulse by their neck or their veins on their hand. The next step is call for help. I've split these steps up into 3 different slides, but this needs to be done very quickly. Even better, if you can get somebody to call the police while you perform CPR, that's even better. The faster you get these things done, the quicker it's going to be easier for them to help the person once they get to the hospital. Because it doesn't take long for someone to pass away once they go into cardiac arrest. There's no such thing as going into cardiac arrest and passing it on its own. It has to be solved by a doctor, or it's a very grand emergency. So calling for help, you need the help of a professional. So anyone like 911 or anything like that, a professional that can get this person help and quickly, you need to call them. The next step, this is very important. This is the beginning of the compressions. Compressions is basically CPR itself. So it's broken down in a couple steps. First, you want to place your hand on the middle of their chest. I mean, don't be gentle with it. CPR is a very fast and heavy exercise. So when you put your hands on their chest, you want to interlock your fingers so that all your force is going down. You want to get on your knees and press hard. A good rule to go by is the song "Staying Alive." You want to go by that beat, and don't go too fast. You want to, like you're breathing, you want to make sure the chest comes all the way up and push down. Like, even in some cases, there's broken ribs from performing CPR. It has to be done hard because you want to push 2 inches in because you're forcing their lungs to breathe, so there's air to go to their brain. A couple rules like to think about when you're doing CPR. You want to go about 100 to to 120 compressions per minute. That's a lot. So you need to be pumping fast and hard. Fast and hard, especially for people with bigger chests. You need to really push down. Chest recoil. Make sure that you're getting full range of motion of their chest going up and down. Keep going. When you stop, it kind of messes up the CPR. You have to keep a steady flow. Staying alive, that song really helps. Just keep on forcing that chest down and wait for help. That's pretty much the final thing. You have to keep the CPR going until help arrives. A good kind of thing to think about when you're doing CPR is CAB, C-A-B. C, compressions, what we just talked about with the pressing down. A, airways. You want to point their chin to the sky so that when they're trying to get air, it's easier. Their airways are not bent. It's going to be easier for them to get air. And B, this is optional. I mean, if you're not comfortable with mouth to mouth, that's fine. But you want to breathe into their mouths to give them that oxygen in their lungs. This helps a lot with CPR because they're not getting that air that they need. So you're helping them in this way. So remember CAB. Next, I want to talk about the EED, the defibrillator. Basically, what we just talked about is emergency, like in the case of there's no defibrillator. But many public places have a defibrillator. Defibrillator helps with cardiac arrest because cardiac arrest cannot be timed or managed. So with the defibrillator, you can find it any public place. It might be on the wall, in the emergency room, like first aid. It's basically a machine that electrically shocks the person that is going through cardiac arrest to restart their heart. The steps of using it is very simple. And you're gonna press the start button. It's gonna walk you through most of them walk you through the steps of giving that aid. You wanna make sure that you take their clothing off where you will be applying the AED, and you wanna make sure that it's dry there. You wanna place the 2 pads on their chest and press the start button. Every machine is not gonna be the same, but they're made to be very easily usable so that people can get quick and fast care without the hard learnings of the real CPR progress. In conclusion, it's very important to learn CPR. You can become a hero in real life. You can save a life because it can happen to anybody. It happens a lot. Cardiac arrest is something very dangerous. It doesn't matter if you're old or young. Cardiac arrest is something that we can't control. When your heart stops, you need aid now. Even yourself. Teaching your family members and friends how to respond when that emergency happens, because it can be the decision between life and death. And thank you for your time. I think everyone should learn how to do CPR. This was Everything You Know About CPR by Corey Houston. Thank you so much.